Christina. I'm recording this video for Surgical Procedures ST140, Herzing University. This is for modules 3. So basically what we're gonna do here, we're just gonna go over a couple supplies that were in my kit. I'm gonna start with these sutures. On this packet, it's a polypropylene 4O non-absorbable suture. So we are gonna open this together, and of course, it's just for fun. It's a mock suture, so it's not real. And these can come in a pack, but we just grabbed a single one, depending on how many you're gonna need. You'll grab what you need. It more than likely will come with a needle, so you have to be really cautious to not injure yourself. Obviously with more practice, I will open it better, but for demonstration purposes, it's a little harder. But you definitely will handle this with what are called needle holders, I believe. And it's basically so you don't have to hold it with your fingers, which actually that's how I thought they were handled, but obviously that can cause some injury. Jumping to the next item, which I have my little handy index cards here. So these are, well, there's like fake blades in there, but you could call this like a sharps disposal box, if you will. So yeah, so these are used on the back table to hold and organize your suture needles, scalpel blades, and hypodermic needles. And this will be pretty neat, again, just to keep everything organized so that you're not scrambling and maybe again hurt yourself, because that's something that you want to avoid. You're already doing surgery on somebody. The last thing we want is to have an injury. It can happen, but we just want to avoid that. So yeah, that's what that is. And next we are going to do these suctioning supplies. This one, which is kind of like a blue looking one, it's plasticky. This is the suction tip Yancure. So these do have attachments, again, for when they need suction. Each one is a little bit different. And then this is the Frazier. This one, we can open it, which again, it will already be open for the surgeon because you want to be prepared. So this one, and as you can notice, this one will probably suction a little bit more than this little tiny thing. So each one will probably be a little bit different. I mean, these could be used for almost any type of surgery, I would say, that require suctioning. Just depends on how much needs to be taken care of. Let's jump to these. So these, the blue indent here, so we've already learned that that is the radial pack that is going to be shown in an x-ray if it is accidentally left in a person's body by mistake. So it's a 4x8 and they are supposed to come 10 in a pack, which you can, I think I had already opened this, but you can open it and count them. 2, 3, 4, 5, 6, 7, 8, 9, which I already opened it, which is why there's one missing. And at that point, if it's not complete, then we would just put it to the side because it's not the complete 10 Raytech sponges that we need. So there you go, nice example. These little blue surgical towels, I mean, they're universal, so they could be used for multiple purposes. On the mail stand, on the back table, as well as, you know, establishing a sterile field for draping. And then we have this final one here. These are lap sponges. Again, they should already come in a pack. There should be 5 in a pack. And these are for open abdominal procedures, orthopedic procedures. And again, you could go ahead and count them. So 1, 2, 3, 4. Again, I think I already opened this for another video somewhere, which is why it's probably missing. But again, it's good to just count them because in, you know, reality, sometimes these can be missing 1 or 2. So if it's incomplete, you just put it to the side. So then therefore, you know, this was already missing 1 or 2. It's not actually in the person's body, but that's why it's good to just separate it and count it. So yeah, that was like a good demonstration of my supplies there. And it's good that we're getting like our hands on stuff and stuff like that, especially like, because you know, that stuff can happen. I wouldn't say that I feel super duper confident to do labs just yet, but I'm definitely excited to just be hands-on in the real world, if you could say, because that's how I learn. I'm a visual learner, and I think the more that I do something, the more that I will get a hang of it. In my clinic, I don't really see any of these things except for the sutures, and we rarely do stitches on patients. It's a very rare occasion. And we don't have any of the, like the surgical towels or the lap sponges or these that are the Raytech sponges. So yeah, I think it's just about like practice. And then I would be more comfortable and familiar with stuff. But yeah, I think the more that we're learning about it, the more I'm like catching on to stuff. Like with if it's missing, you gotta put it to the side. But yeah, hopefully this was helpful and informative for you guys.